Hello class, for Section B, Intervention for Individual, I'll discuss dialectical behavior therapy, also known as DBT. DBT was originally developed and evaluated for the treatment of women diagnosed with borderline personality disorder in the community. Since then, the evidence base for its effectiveness has expanded considerably to individuals with co-occurring mental health and substance abuse. So for my assessment with Jamie, I started with a biopsychosocial history and assessment. This biopsychosocial framework is used as an approach to gain a systematic view of the individual and an integration of biological, psychological, and sociocultural factors on human development and function. Next, I use the DBT Client History Survey, which provides a full history of Jamie in order to most clearly understand her situation and align her with the most appropriate treatment. Next, I use the Reasons for Living Scale, which is a self-report questionnaire that measures Jamie's expectancies about the consequences of living versus killing oneself and assesses the importance of various reasons for living. Next I did the substance abuse history interview, which is an interview to assess periods of drug use, by drug, alcohol use, and absence in Jamie's life over a desired period of time. And last, I did the DBT Ways of Coping worksheet, which provides a snapshot of Jamie's current coping skills and response to emotions. After assessing the client, I believe she would benefit most from going to an inpatient women's facility that addresses co-occurring disorders. She could begin DBT in an inpatient setting while working on her recovery from schizophrenia and addiction. Also, due to her homelessness, it would be difficult to comply with outpatient DBT until securing stable housing. Inpatient rehab program would allow Jamie time to relearn valuable life skills, grow spiritually, come to terms with unresolved wounds, or emotional hurts from the past, and learn how to self-identify people, places, and things that trigger drug relapse. She would then be reintegrated back into the community and continue treatment in an outpatient setting. 3 major theoretical frameworks combine to form the basis for DBT: the philosophy of dialects, the mindfulness practice of Zen Buddhism, behavioral science biopsychosocial model of the development of chronic co-occurring mental health and substance abuse issues. Tools and techniques. So there's 5 functions of treatment in DBT. DBT is more of a program of treatment because it includes individual therapy, group therapy, and a therapist consultation team. And it's important to remember that the most critical element of Jamie's DBT program has to do with whether it addresses the 5 key functions of treatment. So function 1 is enhancing capabilities. Function 2 is generalizing capabilities. Function 3 is improving motivation and reducing dysfunctional behaviors. Function 4 includes enhancing and maintaining therapist capabilities and motivation. Function 5 is securing the environment. And an example of securing the environment would be, for instance, to avoid drug use, Jamie may need to learn how to avoid certain social circles that promote drug use. And in DBT, the therapist will have Jamie modify her environment. But if Jamie, is ambivalent towards doing so, the therapist then will take an active role in changing the patient's environments for them, which I thought was pretty interesting. 2 is modes of treatment to ensure the functions are addressed. So to ensure these 5 functions are addressed, there is a skills training group that is a psychoeducational format structured specifically for the learning and rehearsal of new skills. There's telephone consultation that provides brief telephone conversations to assist the client in identifying an appropriate skill to employ and to overcome obstacles to using the skill effectively in between, sessions. Then there is a case management, which the main aim is to ensure opportunities to use new skills and create an environment which recognizes, facilitates, and reinforces the effective use of new skills. And then the consultation meeting is a weekly meeting held by the DBT team to review cases and for therapist skill development. Then there is mindfulness, is another tool or technique of DBT. And mindfulness focuses on improving an individual's ability to accept and be present in the current mood. Next, there is a distress tolerance, which is geared towards increasing a person's tolerance of negative emotion rather than, hiding from it or escaping from it. Then there is also emotion regulation, which covers strategies to manage and change intense emotions that are causing problems in Jamie's life. And then last is interpersonal effectiveness, which consists of techniques that allow Jamie to communicate with others in a way that's assertive, maintains self-respect, and will help in strengthening her relationships. So, treatment plan. So, the main goal when DBT was first developed was to help clients build a life worth living. With that being said, the desired outcome of using DBT with Jamie is a resolution of her maladaptive behaviors related to impulse control and emotional regulation, especially behaviors that may result in her continuing to use substances or engage in self-harming behaviors. So the first goal, and I want to say that DBT happens in stages. So it has to happen in these 4 stages, which are also goals for her treatment. So the first goal is, the focus is the stage of stabilization. So Jamie is dealing with a number of things, such as managing her mental health, suicidal behaviors, her addiction, and losing her children. So therapy for this goal would be centered on safety and crisis intervention. So the goal is to help Jamie achieve some control over her problematic behaviors. And Jamie's objectives to meet this goal are to complete and comply with a contract for safety regarding suicidal behaviors, stop the use of drugs, and to begin taking psychiatric meds. Stage 2, the behaviors are more stable, but mental health issues may still be prevalent. So emotional pain is typically brought to the surface in this stage, and traumatic experiences are safely explored. So the goal of this stage is for Jamie to fully experience her emotional pain instead of silencing or burying it. Jamie's objectives are to address past and present trauma, including the loss of her children. Stage 3 focuses on enhancing the quality of life through maintenance of progress and reasonable goal setting. So the goal of this stage is the promotion of happiness and stability. Jamie's objectives are to begin family therapy sessions and have visits with her children. Stage 4. During this stage, the therapist supports Jamie in advancing her life to the next level. So in therapy, Jamie may improve upon learned skills or work towards spiritual fulfillment. So the goal of this stage is to help Jamie achieve and maintain an ongoing capacity for happiness and success. Jamie's objectives are to find stable housing and employment and to attend community NA meetings. So time and session. Jamie will attend weekly 2-hour group skills trainings and a minimum of a 1-hour individual therapy session every other week. And these sessions can be moved to weekly if deemed necessary. And she will also have a 24-hour telephone coaching available to her. Strengths. So the primary strength of DBT is that it has been shown through randomized controlled trials to be an effective treatment for bipolar disorder and co-occurring disorders. The treatment is well received by clients and has a high rate of treatment adherence among this population. The limitations. The limitations include limited research. So much of the available research on the efficiency of DBT included small group sizes and focused on a specific sector of the mental health population. So critics say that more research should be done to determine whether DBT works well for those with a varied or complex mental health concerns. DBT includes intensive training. In many of the research where DBT was found to be effective, the providers implementing the treatment were doctoral level students or higher, and most were trained by the developer herself. And the third limitation is many of DBT many of DBT research trials lasted up to a year, and some include a post-treatment follow-up interview. However, it was not determined whether therapeutic gains lasted behind the post-treatment follow-up interventions. Methods of evaluation. So the methods of evaluation for Jamie would include weekly urine drug screens, UDSs, to determine abstinence from illicit substances. The UDSs will be random, and another method of evaluation would be medication management, which would include weekly checks of psychiatric medications to ensure compliance. Then I would do a pre and post test as an evaluation, and the pre and post test would include questions on mental health symptoms, drug use, and coping skills. I would also complete DBT ways of coping worksheet at the end of the therapy to compare Jamie's coping techniques from when she first began to when she completed to determine new skills were learned. Prognosis. I believe the prognosis for Jamie is good. I believe that if Jamie begins taking medications for schizophrenia, combined with abstinence from substance use and learning and implementing new skills, DBT would be an effective treatment to meet her needs. Quote from Chapman, 2006, states the patients for whom DBT has the strongest and most consistent empirical support include suicidal women with borderline personality disorder. There is also promising data on DBT for women with mental health diagnosis who also struggle with substance use problems. Kind of similar to Jamie. Research Article 1. So although I do have 4 references, I chose 2 of them to do the summaries on. So the first research article, the aim of the study was to review the evidence base for the DBT model for borderline personality disorder and the effectiveness of modified DBT for use with clients with comorbid disorders across the lifespan and across a range of clinical settings. The study included a review of the literature and clinical data from current services and provided an abundance of information on DBT. The study found that modifications of DBT have been shown to be effective for individuals with comorbid disorders and across the lifespan. Research Article 2. According to the article, DBT is well-established treatment for individuals with multiple and severe psychosocial disorders, but because many such patients have substance use disorders, the authors developed DBT for substance abusers, which incorporates concepts and modalities designed to promote abstinence and to reduce the length and adverse impact of relapses. The article provides an overview of DBT and its procedures, along with extensive information on DBT with co-occurring individuals, including prevalence and treatment interventions, goals, and objectives. And then last is my individual references. And then we will move on to our family therapy.